Hi everyone, Dr. Brian Stein here at Wilkins Spinal Care in Mount Pleasant. This week we're going to discuss a tool that we have in our office. Last week's video we talked about headaches and how we can help with headaches. Now we're actually going to show you a cervical tool that we use for patients who have a loss of their cervical curve and an increase in headaches. So several videos ago, probably back when I first started these blogs, we did a blog on the human spine itself. And one thing I talked about was the different types of curves that our body has. Now in the cervical curve, we have something called a lordotic curve, which is that C curve that I've drawn several times. This is what that curve is going to do. It's going to help bring that curve back. Now, why in the first place would a curve become straight, or what we call a reverse curve, or what I like to call a lowercase r? Modern technology is a great thing, but it is also a vengeance to our body. Just imagine what we're doing all day. I don't have my phone because it's used on the camera, but people are texting all day, looking down at their phone. People who work at a desk all day, they're typing, they're hunched over, okay? Here's another thing that people do a lot of. They slouch like they're Neanderthal, pretty much. This curve, this Denneroll, the cervical Denneroll, will help increase your curvature of your neck, but that doesn't mean it's just alone. This is what needs to help. Here's things that you can do before I demonstrate the Denneroll, things you can do to help increase your posture, help increase the curvature of your spine. When you're sitting, don't slouch like this. You want to sit up nice and tall, have your shoulders leveled with your ears just about, sit up straight, just like this, chest sticking out. That's a good posture right there. Another thing, don't be afraid to tuck your chin a little bit. Yeah, it gives you a double chin, but when you do this, that's what helps increase that reverse curve. So you want to push in just like this. And this is just about a good curve, okay? Another thing, when you're texting on your phone, instead of texting downward, bring it upward and do the texting, okay? There shouldn't be a problem with that. When you're typing on a computer, a lot of people, they're sitting at a desk, they're like this. Don't be afraid to bring your keyboard up, okay? They have different little platforms that you can put your keyboard up higher, so you're not looking down at your keyboard, you're looking more straight up. And there's another common thing nowadays, people have standing desks. Standing desks can be both good and bad depending on how you use them. If you use them wrong, you're looking down, you're writing, typing like this, yeah, that's not good. That's the downfall of a standing desk. But if you use it properly, you have your computer propped up higher, then yeah, that's you're doing everything right there. So there's just a couple different things that you can do to help increase the curvature of your spine. Now what I'm going to do now is I'm going to demonstrate the cervical Denneroll. The cervical Denneroll, it's made of foam, it's patent designed, and it has a convex curvature right up here at the top of the base here. It was designed by Chiropractic Biophysics. It's a prestigious chiropractic technique. They have different instrument tools other than just the Denneroll that help increase the posture and use ergonomic exercises to help take nerve interference out, just like we do as chiropractors. So I'm actually going to demonstrate the Denneroll itself. So I'm going to have the camera person come on over a little bit closer. I'm going to show you what to do. First things first, you want to be on a hard surface floor like this. You have a carpet, you can do it on a hardwood floor. I do not recommend that you do it on a bed or anything soft because you're not going to get that firmness. This floor is just perfect, it's flat, it's something sturdy for you. Another thing you want to do, when you first come into our office, when we do a scan of your neck, an x-ray of your neck, we'll be able to show you what area of the neck needs to be changed. Some people just need an upper cervical reverse change, some people have a middle reverse change, and some people have a lower reverse change. So just say someone has a complete reverse curve of their neck. Most people, I just tell them, put it in the middle of your neck because you're going to get the best of all three, upper, middle, lower. Now what do? Right here it says shoulders on this side. It's real hard to see, but it says shoulders on this side. You place it down just like this, and then say I'm a patient who has a complete reverse curve of my neck. I'm going to have the middle of my neck on this convex curvature right here, and then you'll just relax just like this. Now the question is, and I'm going to stay here for a few moments as we talk because it's actually very comfortable. What you do is set a timer on your phone. for 2 minutes. Say it's the first time I'm doing this. Set a timer for 2 minutes. Once that 2 minutes is up, you take it off. Later on in the day, do it one more time for 2 minutes. Each day, you add a minute. Okay, so today I would have done 2 minutes for 2 minutes for today. Tomorrow, I'll do 3 minutes twice a day. Next day, I'll do 4 minutes twice a day. You'll do that every day until you'll get the 20 minutes. Okay? Now, here's the biggest question that people ask me all the time. What if I can't do 20 minutes in 18 days? That is not a problem. I have patients that can only get the 5 minutes, 6 minutes, 7 minutes. That is not a problem at all, because it is uncomfortable, because you're physically changing the curvature of your spine. This is yours to keep. You know, you could buy it at our office. That is yours. It's not ours anymore. You have it. You can do what you want with it. So you add the minutes as much as you can. If you can only get the 10 minutes, stay at 10 minutes. There's no shame in that at all. You're still having a positive influence on the curvature of your neck. If you can get to 20 minutes, great. Okay, some people have them for so long that they don't need it anymore. And that's another question people ask. Do I need this forever? It's always good to have, okay? I necessarily don't need it because I have a good curve in my neck. So, and that's also taken years and years and years for me to do. But it's yours. Say you stop using it in a year, like, oh man, I really need to use it again. Use it again, okay? That is yours to keep. So don't be ashamed if you can't get that 20 minutes. It's okay. You're doing everything right because you're still influencing everything. That's all I have for you guys this week. If you have any questions about the Denneroll, we do sell them in the office here. We have pediatric sizes, we have small, medium, larges. And if you have any questions about posture and some different techniques I have for, texting, looking at your phone, typing on the computer, reach out to me. I'll be happy to give you that information and answer any questions for you. Otherwise, everybody have a great day, and we'll see you in next week's video.